Now I would like to introduce Charles Roberts, Director of Research, Microbiology, and Chemistry for Advanced Sterilization Products, to discuss the science behind sterilization.
Thank you, Patty. Before we begin to talk about best practices and the importance of terminal sterilization, I'd like to provide some context around healthcare-associated infections. Healthcare-associated infections, or HAIs, are one of the top 10 leading causes of death in the United States, and approximately 5% of hospitalized patients experienced an HAI. An HAI is defined as any infection that a patient acquires during treatment for a completely different health issue. There are many efforts underway to reduce HAIs in the hospital setting. When we think about infection risk to patients, we think about 4 levels of risks, from high, which includes equipment such as surgical instruments that require cleaning followed by sterilization at a minimum, to a minimal, which includes floors, walls, ceilings that require regular cleaning and drying. Let's talk about the differences between high-level disinfection and terminal sterilization. As discussed before, HIAs, or infections not present on admission and acquired by patients in a hospital or other healthcare facility, are a major public health concern in the United States. What does this mean for my patients? They have longer healthcare stays, utilize more healthcare resources, such as IV antibiotics and clinician care, and are at a greater risk for readmission and death. The Centers for Disease Control and Prevention estimates that 1.7 million people acquire HIAs each year, nearly half of which are attributed to surgical site infections and bloodstream infections, resulting in approximately 271 deaths per day, or the equivalent of 1 airline crash. Regrettably, 1/3 of HIAs are considered preventable. According to the Centers for Disease Control, the top 5 most prevalent HIAs are blood infections, after-surgery infections, urinary infections, chest infections, and skin infections. These infections are transferred through airborne transmission of droplets from food, from blood, from contaminated drugs, and from person to person, or even insects or animals. HAIs also contribute to increased healthcare costs, with an estimated annual economic impact of more than $17 billion in the United States. In addition to the harm caused to the patient, there are financial costs associated with HAIs. The excessive cost for HAIs is often covered by the hospital rather than third-party payers. There are a number of studies that calculate the increased cost of an HAI. One study in 2003 in Chicago found an excess cost of almost $7,000 for a suspected infection and a little more than $15,000 for a confirmed HAI. Hospitals face greater economic incentive than ever before to reduce infections. As of October 2008, the Centers for Medicare and Medicaid Services stopped reimbursing for the treatment of certain healthcare-associated conditions that have evidence-based prevention guidelines, including the following HAI conditions: catheter-associated urinary tract infections, vascular catheter-associated bloodstream infections, and surgical site infections following coronary artery bypass grafts and certain orthopedic procedures or bariatric surgery. When we look at the different microorganisms, bacterial spores are the hardest to kill and require sterilization, as sterilization kills all microorganisms. At the next levels, high-level disinfectants, HLDs, destroy all vegetative organisms, everything below mycobacteria, including some bacterial spores, but not necessarily all spores. Low-level disinfectants kill most bacteria, some fungi and viruses, but will not kill spores or not usually Mycobacterium tuberculosis, or the agent that causes TB. Groups such as the FDA, AORN, and APEC define a sterilized device as one that has been processed in a system that delivers a sterility assurance level of 10 to the minus 6, or 1 in a million chance of non-sterile occurrence. The requirement for sterilization is that all viable microorganisms be inactivated, including bacteria, fungi, virus, and bacterial endospores. The device also needs to be packaged in a manner that will preserve its sterility and allow the device to be transferred to a sterile operating field without contamination. Terminal sterilization is the best practice for devices intended for use in the operating room setting where the device may touch normally sterile tissue. High-level disinfection is a process where all viable microorganisms are inactivated except bacterial endospores. High-level disinfected devices are generally not packaged in a manner intended to preserve sterility and have residual moisture from the rinsing portion of the process. High-level disinfection processes are typically used for semi-critical devices at the intermediate level of risk that may touch non-sterile tissue, such as GI and respiratory equipment. For situations that are a low risk to patients, cleaning and drying and possibly the use of a low-level disinfectant would be appropriate. Patty mentioned earlier the definition of sterilization. We're going to cover the best practice for devices intended for use in an OR setting where the device may touch normally sterile tissue. We're talking about devices that are defined as critical devices as defined by Spaulding. The combination of killing all the microorganisms with a 1 in a million chance sterility assurance and packaging the devices to preserve sterility is the highest standard of sterility and is called terminal sterilization. As mentioned earlier, to maintain sterility, the device must be packaged, which allows it to be transferred to a sterile operating field or to be used at a later time. Don't underestimate the value of storing sterile instruments. In addition to being able to move the instruments to an operating field without contamination, in an emergency, the instruments are ready when you need them, allowing healthcare professionals to focus on the medical emergency at hand. Let's talk about one of the most common infections, Staphylococcus, or Staph. Staphylococcus are a genus of gram-positive bacteria, and as you can see in this picture, under the microscope, they are round or cocci and form in grape-like clusters. A staph infection is caused by Staphylococcus or staph bacteria. Actually, about 25% of people normally carry Staph aureus in their nose, mouth, genitals, and anal area. The foot is also prone to pick up bacteria on the floor. The infection can begin with a little cut, which gets infected with bacteria. Staph infections range from a simple boil to antibiotic-resistant infections to flesh-eating infections. The difference between all these is the strength of the infection, how deep it goes, how fast it spreads, how treatable it is with antibiotics. The antibiotic-resistant infections are more common in North America because of our overuse of antibiotics. There have been significant increases in staph infection rates among patients in U.S. hospitals. As we previously discussed, this can result in longer hospitalizations for the patient and millions of dollars of increased costs for health care, often absorbed by the hospital. A study led by Dr. Gary Noskin of Northwestern analyzed more than 45 million hospital discharge records and found that from 1998 to 2003, the prevalence of Staph aureus infections among all patients increased at an annual rate of 7.1%. This problem grew even faster among surgical patients. The rate of Staph aureus infection rose at 7.9% per year for all the surgical stays and 9.3% per year for orthopedic patients.